Second part of medical physics is on X-rays and CT scans. Got a checklist to go through. We need to know how an X-ray photograph is produced. We need to know how a CT scan is produced, and we need to look at the advantages of CT scans over X-ray photographs and other forms of medical imaging. So first of all, just so we're clear on how X-rays actually work, you have some kind of machine up here which is producing X-rays. You put your possibly broken arm, looks a bit broken, in between the X-ray source and some film, so the film goes underneath the arm. You fire the X-rays through, and the crucial thing that some people get wrong is that the X-rays are absorbed by the bone. They're not reflected off the bone, they're absorbed by the bone. The plate goes black everywhere the X-rays hit it, but where they were absorbed by the bone they don't get through, so you end up with the plate staying white. Notice it started off white. Okay, it goes black where the X-rays hit it. Okay, are X-rays dangerous? Well, X-rays are a kind of ionizing radiation. You've done about radioactivity in additional physics. You know that there is a potential risk with all radiation. If you ever had an X-ray, you'll notice there's always signs checking that there's no possibility you're pregnant before you go in. So, but we know that a dose of 1 millisievert, this strange unit, you don't need to worry about this too much, but one of these causes an increased risk of about 0.01% of cancer. If you look at these X-ray doses, even the highest X-rays for back X-rays, spinal X-rays, these are only 0.2, so 5 of those X-rays would give you an extra 0.01% chance of getting cancer. Obviously that's not a risk you want to take unless you have to, but it's a very small risk. If you want to try and put this into some sort of proportion, average background radiation in the UK is about 2 millisieverts, so you would have to have 10 spinal X-rays just to get the same amount of radiation that you got in 1 year. Getting on to slightly more modern ideas, actually the photographic plate isn't that common these days. We use these things called charge coupled devices. This is the same sort of technology that you've got in the phone of your camera, an electronic system for detecting radiation, X-radiation in this case, visible radiation in the case of your phone. Why is that better? Well, lots of advantages. Okay, it's cheaper in the long run because you haven't got to keep buying the film. It cost you to buy in the first place, but you're going to get that money back. If you have an X-ray at one hospital and you want to send the information to another hospital, you haven't got to send a photograph, you can just digitally send the information. You can store it, so you haven't got loads and loads of files with bits of X-ray film in them. You can just store it all on a computer hard drive. You can check them instantly, so you can just send the information from one department to another in the hospital. And also the computer can check it, so sometimes you'll have had people have X-rays and they get to the consultant's not very happy with the X-ray. Often you can solve those problems if you've got an electronic image by changing the exposure, that sort of thing. And also you don't have to put them up on a thing on the wall to look through the light, you can just see them on the screen of a computer. Okay, so the kind of more modern version of X-rays is computerized tomography. That's called a CT scan. Okay, still uses X-rays, but in a slightly more complicated way. So you fire X-rays through the body. Let's suppose, just for example, it starts off with an intensity of 20 in some kind of random units we've chosen. Different sorts of tissues in the body absorb the radiation by different amounts. So what happens when it goes through? You get 20 in, you've got some different things in the way. So the fat maybe absorbs 1, the cancer 3, the bone 6, you end up with 10 coming out. If you've got different things in there, you absorb different amounts, you get different amounts at the bottom. This all looks fine, but you'll notice, for example, in this example that you've got 10 here and you've got 10 there, but there's not the same thing in the way. How do we solve this problem? Right, well, we can't just do it simply by going backwards here. You wouldn't know if there was bone here or if the bone was up here, but what you do is you do it from more than one direction. So once you start to get sets of numbers like this, okay, you can work out that you might get some numbers like this, and it'll only work if the -5 is in the middle. So you do it from different directions, and that gives you more information, and the computer, that's why you need a computer to analyze this, can work out where the problem is. So we know this is lots of fat with a cancer in the middle. Okay, quick ideas about this just to see if we've got it. CT scans use X-rays. Different tissue types absorb the X-rays differently. You rotate the X-ray source around the body, so you're getting the X-ray image from lots of different angles. The body moves through the machine, so you'll see people lying on the bed and the bed actually moves the person through the machine. You need a computer to put the thing back together into an image, and often on the exam, if this is 6 marks, you get a mark for putting this in a nice logical order. Once you've got the tumour, so here's a CT scan picture, just one slice through it, you'll notice this part here is the tumour. What you do, well, you treat this as you'll have learned in year 9 with gamma rays to try to kill the cancer cells, but you don't want to kill the whole brain, you don't want to zap every cell in that brain and end up with no cancer but no brain. So what you do, you fire your gamma radiation in from here, all of this gets a little dose of radiation. Then you fire it in from here, all of this line gets a little bit of radiation, and from here and from here and from here, and as you work around, hopefully you can see, that all of the brain gets a little bit of radiation, but the cancerous area in the middle gets far and away the biggest dose. So it's very important for the doctors to know exactly how big and whereabouts the cancer is, so they can aim their gamma radiation at it accurately.